Many professionals were never taught how to fully assess tongue tie, and families are often left trying to reach their breastfeeding goals without the support they actually need. If feeding feels harder than it should, I don't want you to be alone. I wrote Tongue Tie for Parents to help you understand what's happening and how to move forward with a clear, thoughtful approach. It's the same guidance I would give you if you were sitting with me in my office. It takes a holistic, functional view, guiding you through what to look for, how to think about next steps, and what actually helps. Available now on Amazon. Link is in the show notes. Welcome to the season marking 4 years of the Tongue Tie Experts podcast. I'm incredibly grateful for what this space has become. What started as a simple idea to create thoughtful, evidence-based, and multidisciplinary conversations about tongue tie, infant feeding, and airway-centered care has grown into a global community of professionals who are committed to doing better for babies and families. Over the years, I've had the honor of sitting down with parents, lactation consultants, dentists, birth and medical professionals, therapists, researchers, and educators from around the world. Together, we've explored the science, the controversy, the clinical nuance, and the very real human stories that live at the heart of this work. My hope has always been that this podcast supports you in thinking critically, collaborating confidently, caring more deeply, and helping more people. If you're new here, welcome. I'm so grateful that you found us. To those of you who have been listening, sharing episodes, and sending messages over the years, thank you. Your support is the reason this podcast continues to grow. To our guests and sponsors, special thanks to you for your incredible contribution to this mission. Let's see how long we can keep this going. Please click, follow, leave a rating or review, and share with a colleague. It truly helps this podcast reach more who need to hear these insights. Now, let's get into today's episode. Hi, everyone, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I have with me Maya Bundesen-Magier. She is an OT, an occupational therapist, mother of two, and the founder of MapMyMilk, a digital platform bridging the gap between maternal diet and infant health. In her clinical work, she helps patients regain independence and quality of life after illness or injury. And as the sole founder and operator of MapMyMilk, she empowers breastfeeding mothers to identify food reactivity in their babies and reclaim a sense of control around their infant's health while navigating feeding reactivity with confidence. Welcome, Maya. I am beyond excited to talk to you today. I always have a lot of people reaching out wanting to be on the podcast. I heard of you and I didn't even hesitate 30 seconds before I looked up your email and sent you a message. And I think I sent you 3 messages 3 different ways. We have to talk, right?
Thank you, Lisa. Yes, I was very excited to hear from you as well.
So as far as food reactivity, we have done way back, I think it was the first year I had the podcast going. We're on our 4th year, by the way. And during the first year, I did interview Dr. Trill. And if anyone who doesn't know of Dr. Trill, go back and find that episode because it was a really in-depth episode. It was so in-depth that I also recorded an episode unpacking the episode by myself because there was just so much information and there was so much I wanted to say with the relationship or the comorbidities of tongue tie and food reactivity and making sure we're doing the right thing for that baby at a particular time and looking at all of it without disregarding one of those aspects. So does that make sense to you?
Yeah, definitely. And I love Dr. Trill. We are actually partners with Free to Feed. Dr. Trill and I communicate regularly in order to give food reactivity families the best experience and outcome in terms of figuring out those triggers. So we work closely together.
And it's so important because this is a field, much like tongue tie, food reactivity is a field where there's a lot of noise and not the science is there, but people like to ignore it, right? On both sides. Or spin it, or, maybe the study said that, but this is what you should do, right? That kind of thing. So Dr. Trill is a scientist doing research, and her programs are research-backed, science-backed, and both of you, I have to give a shout-out to independent, amazing women. You in the bio, I said you empower families, but your example is empowering because it's not easy to do this work. So thank you.
Yes. Yeah. I'm happy to be doing it as someone who's lived through it personally. I can relate to all the moms struggling. I lived through it twice, and that's what guided me in making this tool.
Okay. So let's talk a little bit about that, if you don't mind. You're living through it with your own kids. You had is that what brought you to this? Because as OT, you don't learn too much about food, right?
No. Yes. No. It's it did not come to me from a career space. It came from a personal problem space. I have two girls. They're 1 and 3 years old, and both of them had this cow's milk protein allergy. The second one, when she was about 6 weeks old, also had this issue, but it turned out not to be dairy. And that is what led to me trying to find a tool that would help me organize all of my food logs, all of my symptom logs, to try to figure out what was going on with this baby. And there was no good tool. So that is what led me to basically make one myself.
So many of the professionals that I interview have come to their work through their own children. And it's good, but it's also a little sad that we don't have the tools that we're looking for, the things that we need to have as parents, as mothers, especially as professional mothers who have the ability to recognize what isn't there or what we don't know, what we didn't learn, right? So yeah, it's so common that I hear this, almost everyone I interview.
Yeah, it's that we don't have enough support as moms, right? That village isn't there anymore. We don't have enough scientific research going on in general on the breastfeeding diet and the postpartum perinatal space. And then we have all this noise from social media giving us conflicting, confusing information. Even the doctors and the providers are giving sometimes conflicting information. So it's a hard time.
Yeah, and families expect that the doctor knows. First of all, they expect them to understand what they might have seen in a social media post. And they don't, because most doctors hopefully aren't spending a lot of time reading influencers' social media posts. Maybe not. But they're assuming. So I had this example recently when I had a lactation consult with a mom who was talking to me about the way she was timing her feedings based on something she had heard on social. And she just assumed that I knew what that was. I'm not going to name the term, but she was like, I'm using this approach. And I was like, what is that approach? And she explained, and she's like, well, it was an Instagram post and blah, blah, blah. And I'm like, you know what? Your baby didn't read that post. And then she's like, you're confusing me because you're saying different things than I've seen on the internet. I'm like, well, you came to me for a reason, right? You want the professional. So it's really tough. I feel bad for moms today because there's so much input. And yet I'm excited because at least we're learning what questions to ask.
Yes. Learning more questions, learning more topics in general. Like my mom didn't know anything about tongue tie food reactivity when she was raising me. So there's more knowledge, but it's just a matter of the right voices at the right time.
Right, right. So, yeah, and then you mentioned one daughter had milk protein allergy and the other daughter, it wasn't that. And in general, we usually say, well, take out dairy, see if it helps. And when that doesn't help, the next, we go down the list without really knowing for sure, guessing, right?
Mm-hmm.
And I once had a mom come to me telling me that she hadn't eaten anything but chicken and rice for 2 weeks.
I hear that so often.
Yeah. And I was heartbroken for her. And I was like, well, how do you know? And she said, well, I don't even know how she thought. She was just so afraid to eat anything.
Yeah, that's exactly my user base are moms that have cut dairy. Maybe they've also cut soy because there can be a connection there, and they're not seeing improvements. And sometimes they're sticking off those dairy and soy for months when if it was that, they would have seen improvements much earlier on. And that's when they are faced with this dilemma of basically cut out everything, live like chicken and rice, which is not sustainable, switch to formula, right? And those are two bad options. So MapMyMilk hopes to give a third option, which is track everything. Those are data points. It's not random. There is a pattern. It's just hard to see when you're navigating it with a paper and a pencil, basically.
Yeah. So you help, by this app, you help see timing of symptoms next to when the food was taken. Because not every food causes immediate reaction, right? Different babies react. Tell me about that, about the timing of reactions. Yeah.
Absolutely. Yeah. So there's a wide range depending, first of all, as you said, not every protein transfers through the breast milk every time even. And then when it does, there's a wide range. It can be 6 hours, it can be 72 hours, and it depends on mom's metabolism, baby's metabolism, the type of protein. And so the app handles that very gracefully by allowing the mother to flip through different time frames to see which foods are correlated with symptoms in a short period, in a maybe 12 to 24-hour period, in a 72-hour period. And so we can see sort of, depending on that baby and that mom, what is getting flagged. And it's very customizable. And that's on purpose because every breastfeeding diet is different. And so we have a lot of settings and features that are customizable so that a mom with her free-to-feed consultant, with her providers, with her lactation consultant can pick the choices and the features that make sense for her.
Right. So as a lactation consultant, I am so excited about this because I used to try and help people do this without having this tool. And, to know that it was made by a real person who understands this, that means so much and based on science, because I'm sure we could find other apps that do something similar. There's 40 apps to do everything, at least.
Yes.
But I don't want to talk about them. I just want to say we have to be really careful what app we're using because we want it to be following the evidence that we know. We want it to be guided by professionals who understand and know the truth, not just trying to get you to buy their app.
Thank you. Yeah, thank you for saying that. I think it is important to highlight the importance of clinical integrity in a tool like this, because my algorithms and formulas were validated by a biostatistician, and I see a lot of apps popping up now that are AI powered, developed by some 20-year-old who's into the AI wave, but there's no way to validate how some AI chatbot is determining, your baby's trigger is egg. And I actually tested out some of those tools and they were wrong. They were flagging things that are safe foods for my baby. They were missing the real trigger. So it's it's very important right now for moms to be using a tool that is, as you said, validated, backed by science, built by a clinician and by someone, who has lived it and knows what's at stake.
Right. And the other thing is, this isn't a pricey proposition. This is not an expensive app. there'll be a coupon code in the show notes. It's very, very accessible to everyone.
Yes, right. Thank you. Yeah, we have a free tier always. That was very important to me from the beginning. We have premium features, $7.99 a month. If you don't want to pay that, you don't have to, and you can still do basic tracking and pattern analysis for free.
And explain to me a little bit about your connection with Free to Feed and how that works for those who don't know about Free to Feed.
Absolutely. So Free to Feed, like you said, founded by Dr. Trill, who's a biologist and has done amazing research in this space for, nearly a decade, helping families with this issue. She has tons of educational resources, but she also has these amazing one-on-one consultations with various types of clinicians. And so we are their formal tracking partner. So their consultants recommend that their users or their clients use MapMyMilk to track all their food and symptoms and then bring those logs to those consultations for, that one-on-one support. So our tool is about gathering that clinical information, that clinical history, highlighting some patterns, but then we still really value, we're not replacing medical advice, and we really value we're the first stop on your journey, and then you're going to take our data, which is organized and highlighted for you, and bring it to someone who really has experience and can walk you through what's going on with you and your baby on a one-on-one basis.
So this would be an amazing tool for lactation consultants to recommend, lactation consultants, pediatricians who don't have time to walk through all of this with their patients. Even, functional medicine providers who are working with moms maybe later in the postpartum period, and mom is trying to maybe add different foods or take out different foods for her own health and wanting to make sure it's not interfering with baby. This is really, really, really important. And I hope and pray that this gets worldwide attention and gets the use it deserves because of the impact it can have. And I like to say, especially this podcast, it's basically mission-based, my work. I'm not kidding. I don't make a lot of money doing this, but, this feels like a mission-based tool. I'm sure you want to make money because we all deserve to be supported. But I could tell that someone who would do this type of work is mission-based. And that's the heart and soul of women-centered, mission-based, entrepreneurship.
Thank you for recognizing that. It's really true. I mean, yes, we have a subscription service, but I'm still in my day job. Let's put it that way. Yes, I'm still working at the hospital, and I am doing this out of a passion and an obsession with helping these families, whether or not it's profitable, because it is so important to me. Again, because I lived it and because there is a gap. There's no tool that is doing this ethically and the right way. So,
Ethically is so important, right? So, that's why I felt like he was so aligned with this whole platform, the whole tongue tie experts thing, because the ethical and again, mission based and being a woman entrepreneur just makes me so happy. Mm-hmm. So have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, the Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear, and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net. The direct link will be in the show notes. There is, some people might be listening and saying, but this is the Tongue Tie Experts podcast, so why are we talking about food intolerances? So let's touch on that a little bit. As I said, when I interviewed Dr. Trill, and in those 2 episodes, one with her and one just myself explaining or unpacking the episode, I went a lot into that. But let's touch on that here. The why it's important for someone who has a specialty or is seeing babies with tongue tie, why they understand food intolerance as well.
Absolutely. Yeah. So I think you mentioned at the beginning of this episode, there are comorbidities. They can present together, but there's also an aspect of needing to get that differential diagnosis because there's overlapping symptoms. And so maybe they're both happening, but maybe it's just one or the other. And so this is a great tool to get that basic level of understanding of what exactly are the symptoms. And so when a provider, a dentist, a functional medicine doctor is talking with a mom and it's maybe sounding like a tongue tie, but maybe something else, when you get those logs from the app, from the mom, when she sends them to you, because we do have PDF and CSV exports, it will become more clear. Is it both? Is it just a tongue tie? So I can speak about the symptoms of food reactivity, if you'd like.
Yes. Yeah, let's talk about that.
And then maybe you can share maybe more tongue tie symptoms and where do they overlap and where are they different? So there's upper GI and lower GI and skin symptoms, basically. So the upper GI symptoms would be reflux, vomiting. We see a lot of hiccups. Mm-hmm. Lower GI, there's going to be, diarrhea. Mucus in the stool is number one in terms of what we're seeing from our data that we're getting from users. Number one complaint is mucus and blood in the stool. Okay. And then there's just fussiness, inability to calm them down, poor sleep, arching of the back, breast refusal, and then there's also skin issues, so rash, eczema. So these are kind of the most common things that can be under cow's milk protein allergy or FPIAP, which is just food protein induced allergic proctocolitis. And that's not.
We keep inventing new titles for these things.
So many acronyms.
Yeah.
Let's hear about the tongue tie
so
symptoms.
what I want to unpack a little bit and maybe ask you so I learn. I've always thought that the skin symptoms, except for an immediate rash, right? That's one thing. But the eczema, that usually is a slower to appear symptom and maybe the last to disappear. So if you have an enzymatic lesion on your arm and you don't have dairy for a day, that's not going to disappear. Right. So that's important. And that's in real, in grownups too. I like to explain that to people the skin is a slower, except for immediate, mostly really IgE mediated, would we say, right? Like that immediate allergy, like hives and things like that.
Yes. No.
But other than that, that's a slower symptom to appear and leave once you eliminate. So that would be one of those. That's why I like that you have different time frames, right? That's really cool in the app. And then the other thing is that I wanted to ask you this because when my kids were my kids are grown up now, and thank goodness my grandchildren haven't had to have this tested at the pediatrician's office. But I have many parents who say to me, oh, my doctor did a stool test for allergies, for allergy to milk, and it was either negative or positive. Mm-hmm. What exactly is that stool test? Is it just for blood? Are they testing just for occult blood?
So it's the fecal occult blood test, right. FOBT.
That's what
and
assumed.
It's testing for microscopic. You don't have to see it, whether there's microscopic blood present in the stool. And I'm not going to weigh in. I'll just say that different providers weigh the importance of that test result differently. And so it really depends on who you ask. Even just within pediatricians or GIs, some will place a lot more importance on positive blood test or positive alcohol stool blood test. And others will say, look at how the baby is doing functionally, because maybe you have a happy, healthy baby that's gaining weight and there is microscopic blood. And there are some providers that would say, we're not necessarily worried about that. So that's not for me to say, but I would just highlight that it depends who you ask.
Right. And then also the opposite. I mean, I think that you don't have to have blood in the stool to be reacting to a food.
Yes,
right?
Exactly.
So you can go to the pediatrician, they can test it, it could come out fine, but your kid is covered in eczema. And they're saying, well, it's nothing you're eating. Yes. I've seen that too. So I just wanted to mention that because I always like to talk about the loopholes that parents can get into thinking one thing, and trusting and still not having the correct. It's almost like gaslighting. It's a form of gaslighting. Like this is this, so it can't be that. And that's not the case.
Absolutely. It's not, I don't know the history of that test, but I don't think it was ever meant to exist in a vacuum as the one piece of evidence for this. And what you said is so true about that test can be negative because from what I understand is if you swipe in this part of the diaper, maybe there's no blood right there. But if you had swiped over here, there would have been blood. So I don't know, but that I've certainly seen that from an anecdotal perspective. Moms reporting that the test was negative, but it's very clearly something is going on.
Right. And the other aspect of it, if it's not completely explained to the parents, they think that child has no allergies but this test just says there's reactivity to something. It doesn't tell you what it is.
Correct.
So they could either think, well, if it comes out positive, the baby's allergic to milk. Not necessarily. There could be so many other things.
No. Anyway. And I had a GI tell me that milk was the only thing that can cause a positive FOBT, which is not true, which is just blatantly not true. So it really, again.
it could even be trauma. Like trauma can cause it, right? I mean, there's so many things. And you also don't want to test it too early because babies sometimes swallow some blood and tissue on the way out and then, whatever. Or if they've been suctioned, there might be some trauma in there.
Right. Or if the nipple is bloody.
Yeah.
Right?
Yes. Exactly. Yeah. And I've warned moms about that too. If they have had a lot of nipple trauma and they were nursing through it, I've said, if you see any blood in the stool, don't panic. But it's okay to nurse when you have blood on your nipple. Just don't panic when you see it in the stool. Okay. So we were talking about, let's get back to the overlap between tongue tie symptoms and food intolerances. One of the major symptoms is that aerophagia, or that, like you mentioned, hiccuping, or a lot of gagging or taking in a lot of air, and then the air's got to go somewhere. And sometimes it's a lot of reflux. So a reflux symptom, the upper GI symptom, could look similar to a food intolerance. And then even lower GI, I've seen some babies, depending on the mother's milk, this is why it's so individual, especially if a mom has oversupply and they're getting a lot of milk really fast. Sometimes they'll actually have that fast milk with a lot of air intake will turn the stool colors, like a green stool. I've seen that, not from a food intolerance, from a tongue tie. So that's not so common, but it's possible. And that irritability of, a baby with tongue tie is nursing a lot, not getting so much sometimes. And they're hungry in between feedings and they're fussy a lot. And so you don't know which came first, the chicken or the egg, right?
Yeah. And, it's so interesting to think about because we know the breastfeeding diet is a back and forth, right? Baby is reading mom's, body and Mom's body's reading baby. But so I just about the oversupply and maybe like a forceful letdown. So I know that both of my kiddos also had posterior tongue ties, by the way, but my body adjusted to that poor latch by like the letdown
Giving
came
more milk.
Yes, because they didn't have that strong vacuum, so it just came out easier. And so it's just interesting to think about those layers of what's affecting what, and this is why it can be confusing of what's really going on. Yeah.
Yes. And this is why it's important for medical professionals to refer to lactation consultants, IBCLCs, who understand all of this interplay, because there aren't too many initials after a name that are expert in both the mom and the baby and the way the feeding works together. So, I'm giving a plug for IBCLCs always.
Yes, me too.
Yeah. So that adaptation, and I've said that I have many patients where that's the case. And that's why if the baby's gaining weight, everything is fine, does not work.
Right.
Because you can have a really chubby baby who's having a struggle to feed. And I have an example in my own family. Not that he was really chubby, but he didn't have to work to feed at all. He could not suck on a bottle. His posterior tie was so severe. But he was gaining perfectly because my daughter is blessed with blessed or not, she'll say no, it's not a blessing to have that, really active milk supply. Which I hope someday we can do research about what does that mean if mom has like, does that mean that mom's microbiome is off? Does that mean that mom is healing her own gut, needs some gut healing herself, which is what I suspect? And what's the quality of the oversupply milk in nutrients compared to the baby that's getting quite, just enough, or the mom who's making just enough. And, and getting into that, I mean, we can go down the whole pumping thing because, pumping and creating an oversupply is one of my pet peeves, So,
Yeah.
And, what's the quality of that milk? But that's a story for another day.
Yes, another episode.
Yeah, there's so many rabbit holes to go down. So when in my practice and what I teach in my courses is always, if you can, rule out everything else before you consider a tongue tie procedure, because I don't want anyone to have a tongue tie release and then go and say, I had my baby's tongue tie done and nothing got better. Right? And which we hear all the time. And that could be for a lot of reasons. It could be the provider. It could be the inflammatory nature of that baby. It could be lack of lactation support. There's so many reasons. But the main reason that scares me is, there was a tongue tie, but the tongue tie isn't what's causing the problem. There were other things causing the problem. We can look and find a tongue tie. We very easy see a structural tie, but if there's something else, if there's a food intolerance, if there's a cow's milk protein allergy, and we get the tongue tie fixed, that baby is still going to have eczema or whatever the symptom is, right?
Right. And not to say that the tongue tie release didn't even help, but that the baby is still reacting to something in the food. So I think it's a great point, and why I hope the providers who are listening will really see value in having mom track food and symptoms first before you get to that procedure, just to see, is this also a layer of what's going on?
Yeah. And we used to, I've been in this field for a very long time, and we used to rush to procedure. It used to be like, babies should be checked in the hospital and blah, blah. I don't think that unless baby can't latch. There are rare exceptions where that is the case. And then we counsel, anticipatory guidance, like this may not be the be all and end all, but let's get to this place and let the baby be able to open their mouth. Now I get slower and slower every year because there's more to consider. And because of all the criticism and the research that's coming out, for and against the field, we have to be really careful that, and I literally have a framework I named Careful. I keep saying that inadvertently, but I named it the Careful framework that I teach, all about how to make sure that we are considering everything and we're going through things step by step with a framework and not just saying, oh, there's a tongue tie, let's get it fixed, and that's it. There's so much
I
more
love
than
that.
Yeah.
I love that. You're looking at the whole picture and making sure it's defensible, which as an OT working in the hospital, I really appreciate that perspective.
Yeah. Yeah. And one thing I have to say as far as OT goes, I had no idea what an OT did until I met my friend Danielle, who's an OT. And we're in I have a little tongue tie team that we refer back and forth to each other. And I've worked with her collaboratively on many patients, and she taught me what an OT does that I had no idea. And I worked in the hospital for 28 years, and I was like, oh, those are the people that come and do things with the patients. But I was glad the patient was occupied when I was a nurse and the OT was in the room, because I didn't have to worry, right? Anyway, I often say if there's a young person that's looking for a field to go in, and I'm like, be an OT. It's so cool. You can work with any population. You could help breastfeeding mamas. We can work together,
Yeah, thanks for pushing. Thanks for pushing
I love
OT.
OTs, and I love to educate OTs about tongue tie, because I've had a few come to me as patients who had no idea about babies, and when we start talking about all the things, it just made sense to them, and the occupation of feeding. That's what my friend Danielle taught me to say. It's the occupation of feeding. And it's a weird word to use, but they have to find a better name for you.
Yes.
It's like a life therapist. Like a physical therapist for life function or something like that. I don't know. Here I am renaming your field. Sorry about that.
You're not the only one.
But so getting back to why why I'm fascinated by this and why I think it's important, especially for lactation consultants, to be aware of this type of tool. I was taking care of food intolerances without enough knowledge way before I learned about tongue tie, because that was what we thought about. Tongue tie wasn't on the radar unless there was a really tight anterior, obvious heart-shaped tongue, anterior tongue tie. We didn't even consider it. But food intolerances have always been something everybody's always worried what to eat when you're breastfeeding. And we've gone through cycles in breastfeeding education. When I first started, even as a nurse, I was told that it's really important for parents to be careful what they eat, because there was no research. They were just saying that, right? And that was, I think, a formula company narrative that it's hard to breastfeed. You got to really watch what you eat. Mm-hmm. Then there was a whole swing back of, doesn't matter what you eat. You can eat anything and breastfeed, which, I don't really like that. But so I've been through this evolution of the advice to give mamas when it comes to what to eat when you're breastfeeding, what's good for you, what's good for the baby. It used to be, just don't eat broccoli. Right. As if the broccoli is in the milk, right. And the broccoli is going to give the baby gas, right? Yeah. So there have been so many myths along the way, and I just get really excited when there's science-based ways that we can educate our parents and get them to realize that, yes, what we eat is important, but it's not, the myths usually aren't fact-based, and it's individualized. So that's where MapMyMilk addresses all of that. So.
Yeah, I think we're definitely at an inflection point, and it has been a journey getting to this point. My mom told me that when she was breastfeeding, it was avoid spicy food, avoid onion and garlic. Yes. And I'm sure the babies that were fussy, that led doctors to recommend cutting those foods, probably had what we know today as AP or CMPA. They just didn't know it yet. And so as there's more and more research, and right now this inflection point is there's tons, thank God, there's tons of research happening right now related to lactation and infant gut microbiome. And some of those researchers have reached out to use MapMyMilk as a tool for their cohort to track. And I'm just so
really
excited.
Exciting. Yeah, that's really exciting.
I think it's a great time to be looking at all of this as a clinician, as a founder, because I think starting now, we're just going to start to know more and more and be able to give better and better guidance to these families.
And will scientists be able to take the data that you're tracking and use that in some way? Is that a possibility in the future?
Yes. So the data in our database can be de-identified and anonymized to be looked at by researchers. And that is part of our terms of service and our privacy policy that is in there, because we were thinking from day one that this is a data set that could be really useful for research implications. So, yes.
And it's real world experience, which is
and it's such a rich data set of exactly what these lactating mothers are eating at what times, and exactly how the babies are reacting with timestamps on everything. So it's a really rich data set that I think hopefully down the road something can come of that.
So exciting. So, all right, Maya, thank you for developing this tool. Thank you for agreeing to be on the podcast so quickly. Thank you for agreeing to sponsor an episode of the Tongue Tie Experts podcast.
Yes.
So we're supporting each other here, which is, mutually beneficial situation. But I don't just do this with anyone. I do that with people who I feel like are doing things for the right reasons. And my goodness, the potential in this app it's just incredible. So thank you for that. Thank you for taking time out of your busy day with your kids and your 9 to 5 and all that you've got going on with the app. I am so excited to get this information out into the world. So thank you so much.
Thank you for having me. Yeah, thank you. It's so nice to be here talking to you about this.
And MapMyMilk.com is how to get the app, or the App Store, which I downloaded this morning and was looking at it. The App Store,
yes.
right?
Yeah, we are in the App Store. We're working on getting into Android, and you can also use it from a browser at MapMyMilk.com.
Excellent. Thanks, Maya. Have a great day.
Thank you so much.
Bye. This podcast is meant for education and conversation only. It is not medical advice and does not replace formal education, professional training, or individualized care from a qualified healthcare provider. Always seek appropriate guidance for individual concerns. The views and opinions shared by our guests are their own and do not necessarily reflect those of the host or tongue tie experts. Many professionals were never taught how to fully assess tongue tie, and families are often left trying to reach their breastfeeding goals without the support they actually need. If feeding feels harder than it should, I don't want you to be alone. I wrote Tongue Tie for Parents to help you understand what's happening and how to move forward with a clear, thoughtful approach. It's the same guidance I would give you if you were sitting with me in my office. It takes a holistic, functional view, guiding you through what to look for, how to think about next steps, and what actually helps. Available now on Amazon. Link is in the show notes.